I'll be speaking upon a very important topic of ARNI. In its use in heart failure with reduced ejection fraction and preserved ejection fraction. And there are 15 points that I'd like to discuss. We all know that heart failure is it's a very important disease. It's can be said that it is more deadlier than many cancers, and its incidence in India is increasing day by day, and we are dealing with more and more patients of heart failure in general. So ARNI is a new drug. It's one of the pillar in heart failure, where it has been shown to decrease the mortality in patients of heart failure. And one important thing to note is that it was compared with a very established drug in heart failure, which was enalapril. In the trial, the paradigm, heart failure is one of the more deadlier disease. It's more deadly than some cancers. It is more deadly than the some diseases that we think is not as deadly. Like for example, in Hodgkin's lymphomas, it's been compared, but it's more deadlier than that. Secondly, is that the important point regarding heart failure is that it is a progressive disease. Over a period of time, the patient has multiple admissions for heart failure, and these admissions are actually reflective of the decompensation that is taking place in the patient's body, the way the patient is not able to compensate for maybe a higher filling pressure in the heart or low ejection fraction. And finally, it gives into and there are multiple admissions in heart failure, and this finally leads to the untimely or the ultimate death in the patient. The in-hospital mortality or 1 month mortality is also very high in the patients of heart failure. If we see the in-hospital mortality of these patients, we find that the number from various trials may vary from maybe around 10% to 30%, depending on the patients that were studied. They have a very high risk of 1 year mortality also. And that is why this heart failure becomes a very important disease. And at the same time, in India, we see it's even a bigger challenge because we have not stopped dealing with the various diseases that are present you can say in the poor developing countries, like the infective diseases or accidents. And this heart failure, it poses even a more challenge in India, because in India our infrastructure may not be adequate for dealing with problems of both the developed world disease and the underdeveloped world diseases. So heart failure basically would be a combination disease. There are some etiologies of heart failure, like the rheumatic fever or the valvular heart disease, which are more prevalent in the underdeveloped countries, whereas CAD or ischemic cardiomyopathy would be more prevalent in or heart failure with preserved ejection fraction, which would be more prevalent in the developed countries. So India is, I think, in somewhere in between or in the lower side of between. So it has etiologies of heart failure ranging in from where etiologies of heart failure which is present in both developed and underdeveloped countries. At the same time, we can see reflected in the data, in the heart failure mean age of patient in India is around 20 years younger, and in hospital mortality may range up to 30% in India as compared to just less than 10% in the Western world. So this becomes absolutely important because in India we have less resources to deal with a problem that is increasing in magnitude as well as in intensity.